Joining me now is Suzanne Takkenberg, who's Action Against Hunger's Country Director in Lebanon. And Suzanne joins me now. Suzanne, things are escalating very, very quickly. You better just explain to our listeners and our viewers what it is you are doing in Lebanon and what the situation is now.
Absolutely, and thank you for having me today, Trish. So the situation is really, really unprecedented, as you've mentioned. The government estimated yesterday that about 1 million people are displaced at this point in time. And just to give you an idea what that means in terms of numbers, in the UK, that would be the equivalent of 11 million people being displaced in just a matter of days. So within that number, about 250,000 people are actually looking for emergency accommodation and shelter right now because they're unable to actually find alternative housing on their own. And because this number is so high, a lot of shelters are actually filling up really, really quickly. So for Action Against Hunger, we're currently working in 28 of the 777 shelters that the government has opened up. And these are basically schools, vocational training shelters, centers, public spaces, and they've provided them to us and other agencies to basically make available to the population. So we're distributing mattresses, blankets, pillows, hot meals per day, clean water, and also that sort of basic assistance for people as they're scrambling to try to find a safe place to sleep at night with their families.
Now, you touched upon the whole thing about the finding a safe space, and I remember we're talking to people from Action Against Hunger in Gaza, and their situation was there's a similarity is you don't know where the next strike will be because as Will Christo in Lebanon, when we talked to him yesterday, he said people don't know if there's, a Hezbollah meeting place down the road, or there's maybe there's a weapons dump somewhere in your neighborhood that you don't know about. And of course, no bomb just hits one area and stays there. It will take out maybe a kilometer or whatever around it. How that must be a real challenge to you and for people trying to find somewhere safe to go.
Absolutely, and you touched on two really critical points there. One is the implications it's having for the civilian population. I mean, we've seen a huge amount of civilian deaths in the last week, but also in the last 11, almost 12 months now. I mean, in terms of numbers, we have over 1,640 deaths in the last almost year. Of that, it's 104 children, 194 women, and people don't know where they can go, where is safe. So we're also seeing them moving in phases. In the first days from the south, we saw people moving from the very south to Sidon, which is about halfway to Beirut, and then again moving onwards from there to Beirut. And after the last few days, again moving more and more north in the country and really trying to find somewhere that they can go. And then there's the secondary issue, which is ensuring that first responders, such as medical staff and humanitarian employees, are also able to provide assistance in a way that is safe for them as well.
Yeah, because again, you don't know. It's even, you don't know. There's no sort of invading force. Well, God help us, not yet. That you can identify yourself to, or what have you. When the bombs fall, the bombs fall. What do you feel as somebody who's worked in the field for so long? What do you feel when people will say, that's war? Their collateral damage. That's what happens in war. Those are the words. What is it that you see that, you wish they could see, if I can put it that way,
absolutely.
To make it...
Yeah, sure. I mean, it is war, and it is a very, very difficult way to have to operate as humanitarians. And like you say, it's very hard to identify yourself. It's very hard to make sure that your employees, and for me personally, I'm responsible for over 250 staff that have to operate on a day-to-day basis. So there's also that personal pressure that comes into it. But I mean, for us, what is very, very important is also the adherence to international humanitarian law, and to make sure that those laws are upheld and that we are able to utilize those to make sure that those principles are being implemented on a day-to-day basis, that we're able to reach the people that need them most. And frankly, we're not able to right now. Taking the south of the country as an example, we did have an office there and we still do, but most of my staff fled the south on Monday already. 90% of my south team are displaced. they've moved to other parts of the country, and it's been very, very difficult and frankly too dangerous for us to get back down there. And while a huge amount of people from the area have fled, there are still people trapped in the south, and they're not being able to get access to medical services, and they're not getting access to food, they're not being able to utilize clean water, and that's something that we're extremely concerned about.
Can you ever have conversations? I mean, is there any sort of mechanics in which you can have conversations with Israelis to say these are where refugees are? Is there any negotiations at any level, and I'm supposing much higher up, where one government or one people can say to the Israelis, this is where women and children are. This has got to be a safe space and what have you, because even, I mean, they weren't always held to within Gaza. Those conversations could be had. I mean, are those channels open to aid organizations?
I mean, globally, there are those types of systems in place. They're called humanitarian notification systems, and they're extremely challenging to set up, especially in a situation like Lebanon right now, where we've seen the security context deteriorate so quickly. I mean, again, we're talking about, I mean, there have been strikes to the south over the last year, but it's really the last week that we've seen a massive deterioration of the context, and we've seen the operating environment becoming more and more and more dangerous. And so those systems do exist. They take time to get set up, and it requires all sides of the conflict to voluntarily agree to utilizing them, right? And as we've seen in Gaza, it's not so straightforward, and it's not always easy to get it working. So we do hope it will have the system up and running. There's a lot of effort being done at much higher levels than myself, but it has a bit of a way to go.
Lebanon was already sort of not in a good place even before all of this. I mean, they're a country, I might have said before, many, many years ago, gosh, in the 80s, I remember when I worked in the Middle East, worked with an airline doing evacuation flights from Beirut, and I remember how it used to be. It's had successive conflicts. It sort of gets up off its knees and then it's down on its knees again. The government probably, well, many within Lebanon would describe it as not being cohesive. It would have been a somewhat challenging landscape to work in anyway. And then on top of it, this. Is that something that you've experienced?
Absolutely. And I've been working here in Lebanon for about 5 years now. And so I've been here operating during the economic crisis, which was absolutely unprecedented. Our teams also worked during the Beirut port explosion. We had the COVID-19 outbreak. We had a cholera pandemic just about 2 years ago. And there has been an alert on cholera in the country again just a few weeks back. And like you say, it also comes on the backs of multiple wars. And again, what we've seen in the last week has basically blown all statistics from the 2006 war, which took 30 days, out of the water. We surpassed all those numbers in just 5-6 days. And so this is really what we're feeling when we're talking to the population, as well as they've had crisis after crisis, trauma after trauma, and they're really feeling it. And this is also why I think we're seeing so many people in the government-issued collective shelters compared to 2006. They don't have the same capacity economically as families to be able to rent their own apartment, to find their own way. And that really makes it much more challenging this time around.
Do you have any contingency plans? I mean, I'm guessing you're just aren't, you're reacting. You're having to react as an organization to what happens. There's talk from Israel about, or there's some reporting in the Times today. There's talking about Israeli troops amassing on the borders and what have you. Are you bringing more aid staff in? I mean, are you planning ahead, or are you just having to sort of basically play catch up with whatever occurs?
A bit of both, to be very honest. I mean, Action Against Hunger and the broader international community have had contingency plans in place since everything kicked off on the 8th of October last year. But like I say, the level of displacement, the level of crisis in the last week is unprecedented. It's gone well beyond all of the figures, all of the planning, everything that we anticipated. So we do have contingency in place. A lot of agencies, as our own, do have multiple warehouses. We have stock, but we've depleted that entire stock in 5 days. So now we're having to also scramble to find alternatives and to find more. And we will be sending additional support then.
But how do you get that aid in? Because, with more and more flights now just completely cancelling, somewhere along the line there's going to be a question about the safety of the ports and what have you. How are you going to get that aid into the country?
So that is one of the big discussions that we're having. We just had a meeting with the government on this topic yesterday, actually. The United Nations is also being very much involved in this process. They have stock and supplies in the region in different warehouses. And now the issue is how to bring that in safely, if it can be done through land routes, if that has to be done through air, or if it can be done through ports. And so there's also been conversations about fast tracking customs and putting in customs exemptions to be able to get that supply in as fast as possible. So all those conversations are being had at the moment.
Yeah, and I guess those conversations will have to be changing all the time, depending as to what happens. It's a very scary time for obviously the local population, but we're also hearing from Britain. The British Embassy has said to all of its citizens to get out of the country. There are many British people. Then they've also said that they won't let people in unless they are accompanied by a British family member. So you've now got people in the UK talking about trying to get to Lebanon to get people out. But again, no flights. There's a lot of confusion in communications, which doesn't help your situation either, is there?
Absolutely. And this is also changing, like you said, our situation is changing sometimes by the hour and absolutely by the day. We never expected to be where we are today a week ago. And of course, it was already very critical after we had the pager explosions and the VHF radios and so on. Right now, there is the Middle East Airlines company still operating on a daily basis. So there are flights coming in, flights coming out. But of course, that makes many things difficult. Evacuation planning becomes exceedingly difficult. And knowing one had to surge additional staff in to be able to scale up operations, but also for people trying to flee the country. And it's becoming harder and harder. And even for those flights that are still going, they change hourly. Sometimes you have flights that will change the departure times 4 or 5 times in a day. So this also makes it extremely difficult.
If people do want to, give money or, what have you, or make contributions, is there a safe way, a good way to make sure that money gets through? I mean, I'm asking this for viewers or listeners. If they do want to contribute, what are the best ways in which they can do that?
I mean, I'd recommend doing it directly through an international organization, be it through one of the UN agencies or one of the well-recognized international NGOs. Action Against Hunger is one, but there's a lot of very, very good agencies that are working directly on the ground here. And like I say, that is both. Most of those organizations do have direct donation on their websites. I know ours have come live just in the last few days, and it's specifically focused for Lebanon, and same as for other crises. So you can actually select which crisis you would like to donate to as well. And in the cases of those internationally recognized agencies, that does also mean it comes straight down to the field. And I can speak from personal experience that the money with Action Against Hunger that is donated to Lebanon comes to the team here for us to be able to use in the field.
It's amazing work that you do, and I do hope you and all of your workers, your aid workers, do stay safe. I really do. It's incredible work that you do, and I do thank you for taking time out to speak with us today. Suzanne Takkenberg, their Action Against Hunger, she is based in Lebanon. Thank you so much for joining.